The following picture is a visual representation of the patient journey through PoNS for TEP. The PoNS therapy program consists of 2 phases over 14 weeks. Phase 1 is the first 2 weeks, and Phase 2 is weeks 3 to 14. During Phase 1, the patient works with the PoNS trainer 1 to 2 times per day for 5 days for 2 weeks, and also completes 1 session per day at home independently. 1 day per week, the patient performs their 3 training sessions at home independently, and 1 day of the week is a rest day. During Phase 2, the patient is seen once per week in the clinic for a check-in and performs their PoNS therapy at home independently. There is flexibility based on clinical judgment. Please refer to your PoNS training and protocol for further instructions if needed. Assessments and outcome measures will be collected at baseline, prior to starting to the program, and repeated at week 2, at the end of the in-clinic phase, week 6, week 10, and at the end of the 14 weeks. After a 6-month period, the patient will come in for reevaluation. Please note that you'll have access to 2 different protocols when creating a new treatment program and metrics for your TEP patients. The 2 protocols are PoNS TEP. This is the protocol to be followed for patients enrolled in TEP that meet the inclusion and exclusion criteria. And number 2, non-enrollment TEP. This is the protocol to be followed for patients who are not enrolled in TEP, rather a comparison to those who are. The following information outlines the assessment and outcome measures that are to be collected at each time point. It also states if the assessment or outcome measures are a required test or an optional test.